Not only is Minnesota Senator Scott Jensen a family practitioner with a clinic in Watertown, he is also a lawmaker. He was one of the first to raise concerns about this change. I caught up with him for an interview this afternoon, and he's spoken to a lot of folks, but isn't getting the answers he's looking for. When we found out last week that the changes in reporting COVID-19 cases in hospitals and ICUs were being done by the Minnesota Department of Health, you put out your Facebook video. We were able to show some of that. Your first reaction when you heard this was what?
If we are trying to be transparent, if we are trying to include Minnesotans in the conversation, why does the Department of Health do this? A couple of months ago, the Department of Health abandoned their doubling time, and as a metric that we could see. And for the first several months, we'd been shown what it was taking to double each time, if you will, the cases. And all of a sudden that was gone. And I remember, I believe David Orrick had done an extensive article in May talking about how valuable the doubling time could be, and he explained it. We're seeing that happen again. This isn't rocket science. If we know that we have 3,000 ICU beds in Minnesota potentially available, and we know that we have approximately 10,000 hospital beds potentially available. If we're given the number of people in a given day that require hospitalization with COVID-19, or the number of people that require an ICU bed with COVID-19, we can put that number over the denominator, and we can know what percentage of our hospital beds or ICU beds in Minnesota are being occupied by people with COVID-19. That gives us context, and that's really important. So when the Department of Health said we're not going to report that anymore, I was astounded.
Minnesota Health Department recently announced that they would no longer be giving out hospitalization rates and ICU numbers when it comes to COVID-19 reporting. Dr. and Senator Scott Jensen explains why it's significant and concerning.
The Prime Minister of Belgium came out and said that they were not going to be focusing on testing anymore because the testing data was so corrupted or corruptible. They were going to monitor hospitalized COVID-19 patients on a current daily basis because they felt that number was less able to be massaged and was more pertinent for policy making. So Minnesota's saying, nope, we're going to abandon it and we're not going to tell you. And Belgium is saying, nope, we're going to go more toward it.
When I heard the Director of Infectious Diseases for the Minnesota Department of Health give a statement as to why these changes were made, this is what she said. New hospital and ICU admissions data are more meaningful measures to tell us about the severity of the disease. That doesn't tell me why that is changed. Can you explain that? Do you know? Can you understand that statement?
No, I think if you actually analyze that sentence, there's nothing to understand. It was a deflection. I know the Department of Health folks work hard, but that was not a crisp statement. If you want to know the severity of the disease, then we need to know how many people are being hospitalized, how many of those people need ICU beds. You could tell us what the length of stay is. That would be helpful. Are people being admitted for a 2-day length of stay or a 7-day length of stay? Are they being hospitalized for 21 days? Or are they being hospitalized for 10 days? How many are using ventilators? On my other computer screen right now, I've got in front of me Santa Clara County in California. They list how many beds are available, how many people are right now with COVID-19 in the hospital, how many are in the ICU. 40 out of 50 states are doing a better job at reporting this kind of critical information. And there's a lot of Minnesotans who really follow this. I have received hundreds and hundreds of emails in the last few days from people asking, why would the Department of Health do this? Well, so yeah, in my way of thinking, it makes no sense at all unless you don't want to be transparent. And if you're worried that Minnesotans will draw their own conclusions, and those conclusions might be that we're moving in the right direction and that they won't be as fearful and as likely to comply.
Not only are you a medical doctor that is still practicing, therefore that would give you great reason to question the health department and hopefully get some answers because you're a doctor, but also being a senator. And have you reached out within the last 3 days-ish, like Thursday, Friday, today, to see if you could get answers either from the governor's office or the Department of Health? I know that when you ask these questions, it's it doesn't come with accusations per se. You're looking for real answers as to why.
I have reached out, and Channel 5 News the other day had a report where one of the university professors had said that she had reached out and she was waiting for an answer. I wasn't getting answers. She wasn't getting answers. I reached out to Senator Benson, the chair of the Health and Human Services Committee, and I asked her over the weekend, I said, are you being advised of these upcoming changes in terms of what metrics we're going to be allowed to see and which ones are not? And are they asking you your opinion? And she made it clear, no, she's not being conferred with. So it's almost as if, I don't know, I hate to conjecture, but it's almost as if when we start to look too good, then numbers are removed and we're fed different information. But
you have a hard time with that, don't you? Because you are not a conspiracy theorist. You have a hard time thinking, you give the benefit of the doubt. And so I hear as you're trying to say that you're having a hard time even saying it.
I am. I mean, I don't want to go there. It's not fair. These people are working hard. Nobody gets up in the morning wanting to do a bad job. So I think we need to make certain we're trying to dampen down the anger and all that. So I want to be a part of that movement to have more discourse. But I am astounded, and I was hoping that the Department of Health might come out and say, okay, we hear you, and we're going to put it back up. Because if they don't put it back up, it really looks to a lot of Minnesotans like information is being hidden from us. It's very difficult to go back into the Department of Health's dashboard now and try to generate simply those two numbers. At this point in time, how many COVID-19 patients are in the ICU at this point in time?
Don't you think that you would get some of your medical professionals who are thinking the same thing to say this isn't okay and we work in hospitals and this is what we have? Do you see a change coming in the future because of this? I just can't imagine that too many people would allow this continue to go on, that we're not getting these numbers.
Over the weekend, I did hear from physicians, nurses, even hospital administrators who wanted to remain anonymous, as well as, if you will, some people that normally are perhaps disappointed in me, feeling like I should be more quiet and more willing to go along with, if you will, the general conventional narrative. And I have a hard time doing that because I think I have a certain intrinsic skepticism. But I heard from all of those groups that they're concerned. It was interesting to me to watch people who have been somewhat critical of me. They initially criticized me again, saying, why are you so worried about those two metrics? Why don't you just go and look, you'll see them, you can find them. And then when they participated in a conversation, whether it was with me or other participants on social media, they were pivoting and they said, oh, I see what you mean. So I think even people that normally have been very, very supportive of the Department of Health are confused as to why this has happened.
Months ago, Governor Walz issued his stay-at-home order. We didn't know what we were facing then. We all felt in this together. But now the change to how COVID-19 numbers are being reported by the health department is causing more skepticism in an already heated health debate. We want to give the benefit of the doubt. Hopefully I will get to speak with somebody at the Department of Health. We were supposed to have an interview today. Things came up and the interview is not happening. But I also want to give the benefit of the doubt and say there must be some better answers than the answers we've been given so far. Any faith that we're going to get that?
Well, based on the sentence you read to me, I honestly think that you're going to have a difficult time pinning anything down. I do. To me, I would ask this question. If you're committed to transparency so that Minnesotans can indeed feel like you're encouraging them to think for themselves, if you're committed to transparency, then you must build the trust. And when you take these numbers away from us, numbers that we've followed for almost half a year, and these numbers were critical because what they really strike at the heart of is the whole concept of, are we getting close to that point where we might be overwhelming our healthcare facilities? Because initially, that was why I think we saw Minnesotans in droves say, we want to do our part, we want to help. So in March, I think Governor Walz and the Department of Health received a lot of support from, if you will, hundreds of thousands of Minnesotans, both Republicans and Democrats. And
we were, at that point, we were in this together.
We were, and we were told that what we were trying to do was depress the peak, delay the surge, make certain that we weren't going to overwhelm our healthcare facilities. But this smells of something fishy, because if we really want to know if we're approaching the point where we're overwhelming our hospital facilities, we need to know how many COVID-19 patients are in the ICU, how many COVID-19 patients are in the hospital. Because if it's trending downward, and we're somewhere around 130 patients in the ICU when we have 3,000 potential beds, and we're at 275 patients in the hospital, we can get 10,000 beds. I'm sorry, folks, that does not sound like a crisis from which other draconian measures might be, if you will, foisted on us. Because that's really what we're worried about. Is we think, many Minnesotans think, that we've done a decent job, that Minnesota's done okay, and we're not thinking that we have to close down the schools and that we should be thinking about another lockdown. And many people still hold a tremendous amount of skepticism about the testing, whether it's accurate, the whole issue of even masks. But I think most people are trying to be respectful and go along with it.
Senator Scott Jensen, I will continue to knock on the door of the Department of Health and the governor's office to see if we will get some kind of answers. As always, I appreciate your availability, and thank you for doing this.
You're very welcome.
As was mentioned, I did reach out to the Minnesota Department of Health about the changes. I did get a statement which they sent to me saying, for telling us more about COVID-19 severity, which is what we want to portray on our situation update page, this information on hospitalizations by admission date actually gives a better sense of severity of the disease and is very useful when making decisions. The department added it will be adding length of stay to their weekly COVID-19 reports. We'll be back.